All right, good morning. Thank you guys for joining us. My name is Henry Chrysler. I am the executive director of the Mississippi Medical Marijuana Association. I am here this morning joined by Mr. Jay Mason of THC.ms. Although I don't think he needs much of an introduction. I think many of you already probably know who he is. He's a longstanding member of the cannabis community. We're here this morning to discuss terpenes, different terpene profiles and combinations that can be found here in Mississippi in strains grown here by licensed cultivators and sold to patients in Mississippi dispensaries. We hope that information like this will help create a more informed workforce here in Mississippi that can better serve patients with high quality cannabis. So, Jay, I'm going to hand it over to you. I think you've created a pretty useful guide that we're going to go through on the different types of terpenes that can be found here in Mississippi. So, Jay, why don't you take it over?
Thank you, Henry. First of all, it's an honor to be on this with you. I don't profess to be an expert at terpenes at all. I just thought I'd be able to gather some information that I think could be useful for you. I do think terpenes matter, as evidence there. But let's get on to what we are here to talk about. So, the THC website, which stands for the Health Council of Mississippi, all of this information is available there. So, if you can see that now, if you click on what are terpenes, for example, it will go to the terpene guide, which we'll be going over here in a few minutes. And then if you click on purely, if you just want the indica versus sativa ratio, that is available there. So really what I'd like to go over with you now is the August type and terpene guide. And it's designed to do a couple of things that are going to appear kind of logical to you. The first, which was the easiest one to solve, is trying as good as we can to differentiate between indica and sativa hybrid, not using opinions, but using science in a concise manner in which the average patient could understand. So the best thing so far been able to come up with is a ratio, which is the indica sativa ratio. It's throughout this guide, and as you look at it, as you see the strain, the number beside it, a number, a slash, then another number. The first number is the percentage indica. The second number is the percentage sativa. All this information was primarily gathered from public sources, Leafly, Allsbud. I do get some of the information from growers and from COAs as well. Keep in mind that this is a guide. It's designed to help point patients and bud tenders and prescribers in the right direction. It's not meant to be a high-powered scope to give you exactly the answer of the correct strain that's going to solve a specific medical illness. So again, this is a guide. So let me kind of go through it with you. Let me start with the logic. So the first question is to decide or to figure out which medical ailments have the highest probability of being helped with cannabis. So that was the first criteria. How can cannabis help the most? For what conditions? The second question was then, for each of these medical ailments, which terpenes, whether in cannabis or not, no, I think it was, which terpenes in cannabis are most effective for these particular medical ailments. And then what I did with these terpenes is I grouped them into families. And the reason that's important is there are, a multitude of terpenes. In any COA, you may see 20 to 30 of them sometimes, but it's really the top three that matter the most. So I explain it to people, if you look at a box of cake mix, there may be 10 ingredients, but if you get the top three of them right, in the right order, it's going to be okay. You're well along the way to making a good cake. And that's the same with terpenes. So that's done, and then it will also show, so after you kind of guide them in the right direction of, for your particular medical ailment, not only are the terpenes that are best for it, but here are the strains that we have in the dispensary today that best match the strain shown to provide the best relief for your ailments. And then the indica sativa ratio is going to answer the question from the patient, which is typically, will it make me sleepy or more energized? So, we're trying to do as good a job as we can to consolidate this into useful information. So the second page is going to show the nine most common, or the nine ailments that cannabis has the highest probability of success in treating. It's not every medical ailment on the list of approved conditions in Mississippi. It is strictly for what problems does cannabis help best. These are the nine in no particular order. Underneath that, these are by order. These are the terpenes that are showing, in this example of chronic pain, to treat chronic pain the best. And then down here is just a brief description of those terpenes. Okay, this is just meant as a reference. It is helpful, for example, if someone, and I'm a good example of this, I don't like caryophyllene because it's, to me, it's peppery and spicy. So if I'm looking at inflammation, for example, I already know I don't like that particular terpene, so I may want to focus more down here. But again, the nine ailments cannabis helps the best with, terpenes by dominance, top to bottom. Okay, so let's say, for example, someone comes in and says, I am really looking for something for nausea. What is the best thing that you have for nausea? So you can look and quickly see, okay, for nausea, and I listed four just because caryophyllene, for example, is one I don't like, so I may want to look at these three. But so the top three, limonene, myrcene, caryophyllene, all right? So I'm going to go down here, limonene, myrcene, caryophyllene, all right? That matches the top three terpenes by dominance that are shown to have the highest effect in cannabis for nausea. Okay. Again, this is designed to be a starting point. And this is actually a very good example because within this terpene group, there are different variances of indica versus sativa. So on this one, for example, if someone says, I really want something to put me out, it's what I do at night. Well, this one is 85% indica. That would be a great choice for that patient. Or if the patient comes in and says, you know what, I do not want anything that will make me asleep. I want to maybe use this during the day. And this might be a good choice. That's 80% sativa. Two here, fairly in the middle. So this will, and it's both grouped by alphabetical within that family. And then the indica sativa ratio is beside it. Now, something interesting about this is that when you find a family that is most of what you like, I'll give you an example here. So these are ones where myrcene is the dominant strain. So 1, 2, 3. This is my preferred personal playground. These are the strains that I like best. If you were to reverse these, it would be pretty close to the ones that I do not like. So not only is it helpful for patients to be pointed in the right direction of the terpenes for their condition, but it also helps them avoid a negative experience with cannabis. So in the evolution of new states coming on board with medical marijuana, it usually goes in a couple of phases. First of all, and most of you have been through this, it's what's the THC? THC versus cost, high THC, low cost. Then people become a little bit more concerned with the cannabinoids. Then they become more concerned with the percentage of terpenes. And that's about where we are in Mississippi right now, that people are starting to look at both the THC level and the percentage of terpenes. But the problem with only looking at the percentage of terpenes is it's more important to have the correct terpenes rather than, for example, a high percentage of terpenes that you don't like. So this is incredibly helpful when we're looking at helping patients avoid a first-time cannabis experience that is not pleasant. So you can do this a couple of ways. You can start looking at the families first, or These are for the most common terpenes. You'll notice there's, less with these. Also, something that's interesting is some of the strains that are well known, they're really unique in their terpene mix. And I didn't realize this until I started looking at it. But for example, Tangy is a very well-known strain. It's the only one out of these. Now these strains came from me looking at the ones that are most commonly grown in Mississippi today. I threw in some strains from the past that are good for people like me. I'm 58 years old, and I remember strains like Afghan Kush and, some of the old names that may not be done now, but are a good reference point to what those are like, and then grouped them together for them. So Tangy, for example, is one that has a very unique terpene profile. I didn't realize that before. Strains like, for example, Jack Herer. There's only one other one that has that exact terpene mix by dominance. Clementine and Trainwreck, both very, commonly known strains in the cannabis world. They fit a very small profile. Also, something that I noticed. Now, this is the number, or this is the reports alphabetically. The next number is indica versus sativa, and then the top three terpenes by dominance, but it starts alphabetic. The reason this originally came into existence was from a personal experience many times of walking into a dispensary and saying something like, do you have AK-47? And the bartender says, no, we don't. And then I'll ask, well, what do you have similar to it? And then they look at me like I have three heads, because all this information is available, but it's all in different sources, and it's hard to put it all together into a meaningful format. So the first solution was really to help budtenders and dispensaries be able to show similar strains when a customer asked for something that they didn't have. And it kind of evolved from there. So let me keep going through the report with you. So alphabetical, indica sativa ratio, terpenes by dominance. And then this is something that some dispensaries are using. They may print these last few pages front and back, and with a highlighter, just kind of show the strains that they have in stock. But what this is designed to do, and again, this is a guide, it's a science, but it's based on a plant, and it's based on interpretation. If we can just get it close, we're doing all right. But this is fairly close based on the genetics of the plant itself. So again, first number, indica, second number, sativa. Now, something interesting that you'll notice as you go through here is something interesting that I noticed. So we're starting with high indica, top to bottom, left to right. All the way over here, we get to hybrids. And then it's not till really the last column that it's even sativa leaning, sativa dominant. So if you just take a quick glance at it, that's 1 out of 6 columns that are available currently in Mississippi that are sativa leaning, sativa dominant. And some of these are even old strains that aren't currently available. So there's a lot of reasons for that. More difficult to grow indoor is one, but it's very helpful for dispensaries to offer a wide variety of both indica sativa ratio products and terpene mixes to their patients. It's easy to get stuck into ordering and to buying things we personally like, but it's also really good to be able to say, okay, if a patient comes in and they are specifically looking for, they have MS, and they want to take something during the day, what is best for that specific condition? In my mind, I look at this, MS, CLM, CLM, right here. This is the starting point. And right here off the top, well, these are both mostly indica. Okay, here's a hybrid, way indica on the GMO. And you'll see on these, about the best you're going to get is a 50-50 hybrid. Okay, that's good for the patient to know. It's good to be able to say, these will give you, uh, from what we have been able to gather, don't make any medical claims for sure, but from the information that you have, however you need to word it, these are the terpenes shown to offer the best results for multiple sclerosis. Here's how it will affect you. Keep in mind, none of them are really going to be on the energetic side. So again, it's good information. It's not meant to be perfect. It's meant to be a guide. Uh, I'm always looking for ways to improve it, to make it easier to use. The, the biggest challenge is to consolidate a whole lot of information into a format that is useful to the dispensary owner, the bud tender, and the patient. We may end up doing more of a patient-facing format versus more of an index for the bud tenders. Any suggestions you can give on that would be greatly appreciated. My email address is just the letter J at THC.ms. I also want to show you real quick the website that I was referring to. This is THC.ms homepage, just tells a little bit about what all is available. Also has a patient guide that you can download and print. We can also customize those for you. We've done about, gosh, 8,000 of those so far for different growers, dispensaries, and prescribers. Again, none of this is going to be perfect, but it has a lot of information about cannabis. Specifically, you'll find some of doctor to doctor, of really helping physicians understand how to treat patients with cannabis. So none of this information was created by us. It's all, links that we found to other good sources, how to apply for a card. The prescriber list has changed a little bit. You can now look at it by city, and we have added the prescriber numbers. Again, this is self-reported. It's as good of information as we can find. It's never going to be perfect. Please help us keep it as close as we can. Same as with the dispensaries, alphabetic. You can also link directly to their site if that's available. Same for growers. And we even have a bud tender directory. And all of this is available at no cost. But if you click on more here, that's where you can find the type and terpene guide that we just looked at, which you can download and print, as well as the indica sativa ratio. That's just a 2-pager. So I will give it back to Henry.
Thank you so much, Jay. I think that was extremely informative. I think, just a little point about, nothing ever being perfect. I don't think anything in this industry is ever going to be perfect. I think it takes a village to try and put something like this together. It's always a work in progress. So I just want to give a shout out to you on your hard work to try and put this stuff
Thank you.
together. I want to encourage our members to communicate with Jay if they're opening up a new dispensary or if they've spoken to a practitioner in their area that they know no longer prescribes cannabis or has newly started to prescribe cannabis. We've got to start communicating this knowledge more so that we can have comprehensive places that we can send patients and bud tenders and industry operators to so that they can find information like this. It's extremely
Yeah.
important. So I just want to thank you again for going through that guide. Give you a shout out again. THC.ms is the website. You can find both the terpene guide and the patient guide. You can
Yeah.
just download it and print it out at your dispensary if you'd like. If you have any questions, obviously reach out to Jay or I. I think he gave his email address and contact information.
Yeah.
Um, other than
So,
that, oh
so let
wait.
me kind of tell you real quick if I, sorry about that. Kind of the big picture of where we can really improve in Mississippi. So I mentioned the patient guide, and again, you can print these out. We do a lot of these. It's a great tool for education, both for prescribers and for dispensaries. But the reason behind that is to try to keep everyone using the same language, the same terms, talking about the same products. One thing we found is when a patient goes to a prescriber, there's a big disconnect, typically because a prescriber doesn't know the types of products that are available. They don't know how much products cost. They don't know if there's any ratio product. They don't know about this gummy versus that gummy or whatever. So there's a lot we can do for tying that knowledge gap between the patient to the prescriber, even to the grower, so they can learn more. Because a lot of patients want to know, hey, I saw an example of this particular tincture. Tell me more about where it came from. So the big vision here is when a patient first goes into a prescriber, they start talking about terpenes. They start talking about gummies versus inhalation versus vape cartridges versus tinctures. And they talk about the medical conditions and the effects that they want. So that way, and there's a lot of room for improvement on the prescriber side, and they're looking for tools to educate their patients. So in the big picture of things, a patient would go to a prescriber, they would all speak the same language. The prescriber would use something like this or another guide, whatever works, to give to the patient. And the patient will make notes and say, hey, I'd kind of like this 2-to-1 ratio, or I'd like to try this. And, I think I want to avoid this terpene. They then take that information in whatever format it's in, maybe it's a notebook, whatever, to the dispensary to show it to the bud tender who's also talking the same language and understands how it all interacts. And then they're able to both make a good first time recommendation, but even more important is to not have a bad first time experience for that patient. So this kind of helps, get in that direction. It's not perfect. Any suggestions for improvement, whatever we can do, would love to hear it.
Absolutely. Yeah. And I think it's important for everyone to remember that this market is now almost 2 years old. The patients that have been involved and participating in this market and receiving medical cannabis for their ailments, they're becoming more educated about the products that they're using. And so, I think it's important for our bud tenders to start to become more informed about the things that they're selling to patients. I think the beginning of the program, obviously, nation industry, people coming from the legacy market, they're looking at,
Mm.
what has the highest THC, this, that, and the other. I think our patients are becoming more educated. They're learning what works best for them. And so in order to treat them better as a bud tender or a dispensary owner or a cultivator, I think it's important to have this kind of knowledge. This VOD will be posted onto our YouTube channel as well as our website. So be on the lookout for that in the coming weeks. Might take me a little bit to edit it, but it will be worth it to share with other members and your employees to try and keep them informed. We hope to continue doing stuff like this in the coming months. So be on the lookout with our newsletter and our weekly updates. And yeah, if you guys have any questions, feel free to reach out. I appreciate you all joining us this morning.
Great. Thank you, Henry.
All right. Thanks, Jay.
All right. Bye.